All right. Hi, everyone. My name is Ben Panico. Without to enroll, my pronouns are he or they. Um, and let's just dive right in because I have a good bit to cover. So I just want to go over some terms quickly. As we know, the LGBTQ community is very diverse. And we may think of it as one thing, but there are actually two main separate components. The first is sexual orientation. And one term I want to bring up with this is the term queer. This is something that you might know from earlier experiences, exposure with the term, that it used to be a slur against members of the LGBTQ community. So you might not feel very comfortable using it or hearing it. And some older members of the community still might feel a little uncomfortable with it. That said, a lot of younger folks are starting to reclaim the term and identifying with it. So if someone does volunteer that they identify as queer to you, it would be okay to use it in that context. And I just want to mention that sexual orientation is there are a lot of different components of it, including not just your behavior or who you're attracted to, but your community, who you create a family with, who you love. So we want to keep in mind that it's very complicated, and there's a broad spectrum, and the terms I have up here are sort of the most common, but there may be other ways people identify. So just being open to whatever terminology someone uses is great to keep in mind. Gender identity is the other main part of the community here, and that is specifically the T in LGBTQ. And gender identity is someone's internal sense of who they are as a person, how they want to be seen by others and move through the world. Everyone has a gender identity. And for most people, you would identify as cisgender, which means that you were assigned either male or female, most likely at birth. You were then raised in accordance with that as a boy or a girl. You now identify as a man or a woman and feel comfortable with that whole process. For some of us, however, that process isn't quite so simple. Transgender people often don't feel like their sex assigned at birth fits with them and matches who they feel that they are, and they might choose to undergo a gender transition, which I'll talk about on the next slide. For these folks, the term transgender, or trans for short, might fit. So for example, a transgender woman could be someone who was assigned male at birth, but identifies as a woman. Using the pronouns she, her, hers might be appropriate, as would a polite term like ma'am. Other folks who were assigned female at birth but identify as men would be called transgender men. In this case, using he, him, his pronouns is appropriate, as well as a term like sir or Mr. There's also a big group of mostly younger folks who are now not identifying as either male or female in that very binary way. These people might identify as gender queer, gender non-binary, gender non-conforming is another term you might hear, and a common pronoun would be they, them, theirs. But you really want to ask someone their pronouns up front because it definitely depends on the person, and we'll go over that in a minute. So let's talk a little bit about the gender transition process. I just want to start by saying that not all trans people will undergo every single part of this process, especially people who are non-binary may not feel a need to undergo part of this process. But in general, there are three main steps. So you can think of a social transition as just how you present yourself in the world generally. You might start wearing different clothes, change your hairstyle, ask your friends and family to call you by a different name than the one you were given when you were born, and go by different pronouns. The legal process is very specifically about changing your identity documents. And this can be a difficult process because federal government and state governments handle this differently. There are different rules in terms of changing your name and gender marker on your passport versus, say, amending your birth certificate. So I'll talk about it in a minute, but you will want to confirm someone's legal name down the line with them for filling out an application. But definitely in conversation, please use the name someone has asked for you to call them, and handle only legal name when we get there. The last part of the process is the medical process. And this could include mental health care, hormone replacement therapy, and a variety of gender affirming surgeries or medical procedures. I want to make it very clear to everyone that gender affirming care is medically necessary. This has been shown and is widely agreed upon by a lot of international medical communities. So we'll talk about what that means in a minute. I just want to say that transgender people and LGBTQ people as a whole can be found in every community across the United States. No matter where you live or what community you're doing outreach in, you will definitely come across some LGBTQ folks. And as a community, LGBTQ folks have had a history of underinsurance due to, in large part, not feeling trustworthy with doctors and insurance companies that their needs are going to be met. There are a lot of health disparities in the community as well. So really, it's super important, the work that assisters do to reach out to LGBTQ folks and to get them enrolled. Part of that work is confirming with people that the Affordable Care Act protects them and that they should expect to get covered and be protected from discrimination from doctors, and to have all of their health needs met. So the work you all do is very important. Thank you so much for it. And let's talk a little bit about how we can be inclusive when we talk to consumers. So one thing that I mentioned was you always want to ask someone their name and pronouns. And a great way to do this to make people feel comfortable would be to introduce yourself with your name and pronouns, as I did when I started the presentation. And then you can make sure that people know that, you will refer to them by a name that is not what's listed on their, their legal documents or whatever form you have for them. So you can say, do you have a name you prefer I call you? How would you like to be addressed? If you make a mistake, don't worry about it. It happens to everyone. Just correct yourself and move on. And finally, some great gender inclusive language. You might want to use partner or spouse instead of asking someone if they have a husband or wife. A lot of LGBTQ folks are getting married now that we have marriage equality and raising families. So don't make the assumption that someone doesn't have children just because they're queer. And you also want to make sure to ask someone if they're married, because someone might use a term like partner, and then you're not sure if they're legally married or not. So you can go ahead and ask for that clarification. A couple things here, as I mentioned earlier, the best terms to use are transgender or just trans for short. Transsexual and transgendered have become a bit outdated, same as homosexual. One other thing here is that trans is not a noun, so you would never say a transgender, always a transgender person. Finally, you might be familiar with the term sex change or sex change surgery. This is something that the media loved to push a bunch of years ago, and you might still see it in health insurance plan documents, unfortunately. However, it's actually pretty inaccurate. There's not one single procedure that someone would undergo. We much prefer something like gender affirming surgeries. You might also hear the term sex reassignment surgery, also a little outdated, but I want to be sure to mention it because if a client asks you if a policy covers SRS, that's what they're talking about, sex reassignment surgery. So please try to go with gender transition or gender affirming surgeries if you can. And as I mentioned, there are a lot of different procedures in here that someone might want access to, and it can be very confusing. It's hard for the average person to read through a health insurance document to figure out if whatever procedure they need is going to be covered. We do that research. I'm going to give you a little example of how to do it so that you can check plans for trans consumers, but you can also refer people to our website. We will have these guides up by the end of next month, so well within the deadline, to make sure that people are not enrolling in plans that might not cover them. So a little bit about how the Affordable Care Act protects trans people. First of all, doctors are not allowed to turn away people just because they're transgender. A very important point is that plans cannot deny coverage of preventive services based on sex, based on someone's biological sex, based on their gender marker, based on their gender identity. So we like to say that if you have a certain part, you need to get it checked out. So if a transgender woman still has a prostate, she needs to get a prostate exam. If a transgender man has a cervix, he needs to get screened for cervical cancer. So please let consumers know that these preventive screenings are all available and that they should not experience a denial of coverage based on any reason. And we'll talk in a minute about what you can do if that denial does happen. But what assisters can do up front is take a look at the plan documents and make sure that there aren't any exclusions of coverage. So you might see there's some terms listed down here that you might see as categorical exclusions, but you also want to check with those preventive screenings to make sure that there aren't any exclusions in there. I do want to note that these are not going to come up in the summary of benefits and coverage. You need to look in the actual policy documentation. So that'll be the policy contract, evidence of coverage, whatever it's called. You can do a control F search for like the surgical services section. You also want to read through the exclusions. And you can also check the mental health care section and make sure that none of those terms are coming up on the last slide, that there are no exclusions in there. And that, you know, obviously, like I said, if someone has a denial of coverage, there's something we can do about it, but we don't want to enroll people in plans that they're likely to get denied coverage. If there are better options available, that's obviously better. So you can take a look at the document here. The other place to look is in plan formularies. We want to make sure that HIV medications are not in cost prohibitive tiers. And also that hormone replacement therapy is going to be covered and is going to be in an affordable tier as well. So those are two great ways that you can check for trans consumers to see if a plan is going to work for them. Once your client has filled out a plan, what name do you use on the application? So as I mentioned before, please use the name someone has told you they prefer to go by in conversation. And when you get to this point, you want to use whatever name someone uses to file their federal taxes. The reason we do this, there should not be a mismatch. There should be no issue, but just to make sure, we want to make sure that people are going to get coverage and also that they are going to get whatever financial assistance they are entitled to. So the best way to do this is to ask someone how they file federal taxes, what their legal name is, what their legal name is with the Social Security Administration, with the IRS, and use that name. The other thing that you can let transgender consumers know about is after they have already enrolled, they can contact healthcare.gov or their state's marketplace to change their name and gender marker on their documentation there. That's a great option for folks. But just to make sure that there is no denial of coverage, we want to have people use whatever they use to file federal taxes. Next up, I want to talk about the new data collection questions that are going to be on every marketplace application for anyone over the age of 12 for the first time this year. These questions are optional. Here are the questions. So there's going to be 3 new questions: sex assigned at birth, gender identity, and sexual orientation. You can see that there are some responses available. There will also be a free text box in each of those cases, so that if someone does not feel that the responses listed here fit them, they can put in whatever they want. The other things that we really want to make sure people know, first of all, we want people to be aware that these questions will in no way affect their eligibility or plan pricing. We also need people to know that these questions are not going to be passed along to insurers, to their state, or to any third parties. So these questions are confidential. They are remaining in the marketplace. They will not go anywhere else. I would like for you to explain to people, if possible, that data collection questions are super important for the community. They help us understand how LGBTQ folks are accessing marketplace plans, where there might be gaps in coverage, and how LGBTQ health disparities relate to accessing coverage. That said, if someone feels uncomfortable, absolutely okay. They can skip the questions. They can click prefer not to answer. Please also let people know that, just like I said with their name and gender, you can go back into healthcare.gov to update, either change or remove your previous responses at any time. So please let consumers know about that. The one other thing I want to point out here is please do ask these questions of consumers. I know it might not always be the most comfortable thing, but you can let people know that these questions are being asked of literally everyone who fills out a marketplace application over the age of 12. And please make sure you ask it rather than assuming. So if you're having a conversation with someone and they identify as a man and tell you they have a husband, you might make the assumption that they're gay. But actually they might identify as bisexual or queer or by another term altogether. So you don't want to make the assumption and fill out this form for them when that question, when the term gay might not actually apply. So go ahead and ask these questions of folks. They can choose to not answer them if they don't want to, and they can tell you what term works best for them. So we're really excited about these new data collection questions. Hopefully that gives a good overview for everyone. Just let people know that they are confidential. They do not have to answer them. They do not affect plan pricing, and they can change their answers at any time. The last thing I want to mention is what to do about denials of coverage. As I said, might be the case that someone is not able to access preventive care or a gender affirming procedure that they want to have done. This is definitely illegal under the ACA. However, it is still happening. So there are a few different things you can do. First, please let people know that the first step should always be to appeal with the insurer or the Medicaid program. That is the first step, the best thing to do right off the bat. After that, there are a few different options to file a complaint, either with HHS, with their state's insurance commissioner or state attorney general. You can also contact healthcare.gov. You could also reach out to us and we can connect you with a legal aid organization who can help. And then finally, individuals are technically allowed to sue the insurer in federal court under the ACA. So those are a lot of options. Again, it would be preferable if they enroll in a plan that is not going to deny coverage. And that's the point of our trans insurance guides. And also hopefully the help that you can provide. But if it does happen, you know how to get people connected to us. If you have any more questions or want to pass along our information to your consumers, that would be great. Our email and social media handles are there. We have an info account, and please do check back. Our trans health insurance guide should be available by the end of November at the absolute latest. So thank you very much for all the work you do, and happy enrollment.